How do I get fuller lips that still look natural?
Lip augmentation for fuller and attractive lips is a very popular procedure which can be technically performed in a few minutes. When I discuss this procedure with my patients, they often express their concern about people they see with bloated and unnatural looking lips. These overdone lips create a negative perception of cosmetic procedures, especially so-called duck lips, associated with celebrities and other people in the media. However, when lip enhancement is performed with artistry in experienced hands, lip augmentation can be beautifully proportional and balanced. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I perform a variety of facial cosmetic procedures, such as eyelid surgery, facelift, facial fillers, facial implants, as well as injectables, lasers, and other skin treatments. I can attest to the value of artistry with years of experience performing surgical and non-surgical procedures in the face, providing a foundation and an advantage to treating specific areas like the lips. The key is balance. When someone looks at you, they look at an area within an inverted triangle, which includes the eyes, cheeks, lips, and chin. The importance of lips aesthetically can be appreciated by the high level of interest in cosmetics such as lipstick and lip liner. Billions of dollars are spent on products which are sold to create the perception of full and youthful lips. The limitation is that no cosmetic product can enhance or restore lip volume and definition. Before choosing fillers or neurotoxin like Botox or Dysport for lip enhancement, I take photos of your face from different angles. Often my patients will show me how their lips looked when they were younger to give me a sense of whether their lips were naturally thin in the past or any other specific characteristics they want to preserve. Some of our younger patients bring photos to show an ideal lip appearance that they would like their lips to resemble. In addition, I review some important principles which guide my approach to lip aesthetics. I begin with looking at the front view of the lips. With some ethnic-specific exceptions, I apply the golden ratio, also known as phi, which is a ratio underlying beauty seen throughout nature. The ratio of 1 to 1.6 applies to proportions in the face, including the volume and size of the lips. A proportion which also applies to the lips is 1/3 to 2/3, which means that the balance is 1/3 for the upper lip to 2/3 for the lower lip. I also look at the projection of the lips from the side in relation to the chin and other guidelines using specific measurements referred to Ricketts and Steiner lines. I look in detail at specific aspects of the lips, such as the philtrum, Cupid's bow, the vermilion border, the lip body, the G and K points, and the orientation of the outer corners of the lips. I look at the skin quality around the lips, such as the presence of vertical lines and skin discolorations. Objective measures and proportions guide the artistry to determine how the lips will fit with the rest of the facial features. I think it's important to recognize some concepts regarding enhancement of the lips. When patients who are younger come in, there are two common situations. The first is the younger person who feels their lips are genetically thin, or they feel that the upper lip is too thin in proportion to the volume of the lower lip. The second situation is when a younger person has proportional volume in their lips and want to further enhance or beautify their lips. For people who are noticing aging changes in their face, such as loss of volume, where the lips have become thinner with loss of definition of the vermilion border, as well as some or many vertical lines, the purpose is to restore or correct the lip volume and definition. I would also note that more men are coming in than in previous years for lip enhancement. Regardless of age, every patient wants their lips to look natural and not overdone. They are also concerned about how they will look immediately after any procedure done to enhance the lips, in particular the risks of significant swelling or bruising. I discuss a strategy with my patients based on their specific concerns as well as the techniques I apply to allow them to have minimal swelling or bruising. Lip enhancement can include the use of neurotoxins such as Botox or Dysport for vertical lines, outer corner lip lift, and for the upper border of the lip to turn slightly upward, often referred to as a lip flip. The other part of lip enhancement involves the restoration or augmentation of volume. This is where I use different fillers from the hyaluronic acid family, such as Restylane and Juvederm. Hyaluronic acid exists naturally in the body, and the filler material is slowly metabolized and usually lasts about 4 to 6 months. I use different fillers to fill fine lines and volume in the lips. There is a lot of artistry in lip filler placement. The challenge is to place the filler with minimal trauma. Repeated injections with needles can result in swelling, which makes accurate placement more difficult. I routinely use blunt cannulas to minimize needle-related trauma to the lips, and patients are often surprised as to how little discomfort they experience with my approach in comparison to having lip procedures done elsewhere. Naturally, less swelling and the absence of bruising allows my patients to return to their regular activities sooner than they would have with more traditional approaches. Many people come in last minute, needing to look good in a few days. Generally speaking, this is achievable. I do routinely see all my injectable patients after 2 weeks to see how things have settled and to see if additional filler would be beneficial. There is no question that the appearance of lips is very important to facial appearance. Artistically performed lip enhancement can create a remarkable effect on facial balance and appearance. The popularity of lip enhancement procedures makes choosing the right practitioner challenging. Understanding that the ideal experience requires a combination of detailed analysis and planning with maximal comfort and minimal trauma. I hope you found this information helpful. Thank you for your question.